Hi, greetings to everyone. My name is Ruth Barrow. I'm a public health nurse. Over decades, HIV slowly spreads across Africa and other parts of the Western world. The history of HIV can, however, be traced as far back the 1800s. In today's video, we shall be looking at what is HIV, how is it transmitted, what are the risk factors of contracting HIV, when one contracts HIV, what are the interventions available or treatments available, how can we prevent the risk or reduce the risk of contracting HIV. First of all, HIV stands for Human Immunodeficiency Virus. It is a virus that attacks the body's immune system, and it can also be classified as a sexually transmitted infection. HIV can be transmitted through certain body fluids, such as vaginal fluids, breast milk, semen, blood. For transmission to actually occur, there has to be a contact with a damaged tissue or a mucous membrane, or by direct injection into the bloodstream from a needle, syringe, or any other sharp. Remember that the mucous membrane can also be found inside the rectum, the vagina, penis, and then the mouth. Now, who are those at risk of contracting HIV? People engaged in unhealthy or risky sexual behaviors like having anal sex or vaginal sex without the use of a condom are at risk of contracting HIV. Sharing needles, syringes, or other injection equipment can predispose you to contracting HIV. Certain cultural and social factors, such as poverty, lack of access to health facilities, stigma, social and gender discrimination, can also predispose someone to acquiring HIV infection. Transgender women who have unprotected sex with men are predisposed to having HIV. People with multiple sexual partners can also acquire HIV/AIDS. People who are fond of injecting drugs can predispose themselves to acquiring HIV. Gays, bisexuals, that is man-to-man sexual intercourse, are also at risk. An HIV/AIDS mother or an HIV mother can also transmit to the child. In that sense, the child is also at risk of contracting the disease. And people who already have sexually transmitted diseases are predisposed to getting HIV. Now, when one gets HIV, what happens to the person? First of all, we have stages. In the first stage, that is having acquired the infection between 2 to 4 weeks, some people experience flu-like symptoms, and that is the first stage. So the first stage, you have contracted the virus, you can transmit it to someone, and you are either showing certain signs like flu. The second stage is the asymptomatic stage. Asymptomatic simply means that this is the latent stage. This is the stage where you don't actually necessarily show signs and symptoms, but the viral load in you begins to increase, and so you stand a chance of transmitting the disease to someone. However, in this stage, if you happen to start the treatment or the prophylaxis that are available for the HIV persons, it limits you from moving from stage 2 to the stage 3, which is the A stage. It means the stage 1 is HIV. You have the sign of maybe flu, and at that stage you have acquired it between 2 to 4 weeks. Stage 2, the viral load begins to multiply, and then you can break the system of moving to stage 3 by starting with the antiretrovirals that are available. But when that does not happen, then you progress to the stage 3, which is the HIV stage. And in this stage, it is termed as the most severe stage of HIV infection. People with AIDS can have a high viral load and easily transmit HIV to others. The immune system at this stage is highly compromised. It is ineffective to fight the infection, and so the viral load becomes more and more in the blood. Now, how can we reduce the risk of acquiring HIV? There are so many ways to reduce the risk of acquiring HIV. First of all, every individual needs to know your status, especially as sexual partners. We also should avoid sharing of needles, syringes, and injection equipment. Again, we should use condom and other lubricants during sexual intercourse. We need to test routinely for HIV/AIDS so that as at when we realize we are exposed to the infection, we can commence early treatment to prevent us from moving from stage 1 to stage 2 and even to stage 3, which is the dangerous stage. In other cases where people are exposed to HIV, maybe in the hospital settings or in other health facilities, immediately you consider yourself exposed to the HIV virus, you should report immediately and start the pre-exposure prophylaxis that are available. Again, as mothers or people who are pregnant with HIV, try and start the prophylaxis so that it limits the viral load. It reduces the viral load in order that you don't transfer it to your unborn child. Now, those with HIV/AIDS or HIV infection, are there interventions for them? Yes, there are interventions for people or persons living with HIV. First of all, there are antiretroviral drugs or antiretroviral prophylaxis that are available, and this is the recommended medication for people living with HIV. It has actually been tested and proven that antiretrovirals reduce the viral load of persons living with HIV. And interestingly, if you correctly take the prescribed antiretrovirals consistently as being told by your health professional, it can get to a stage where your viral load is so low to the extent that even when it's tested, the tests cannot detect the HIV. And that is what makes it possible for partners. In a case where you have a partner who has HIV and another partner not having HIV, it is this intervention that helps the other partner not to transfer the infection to the other partner because of the low viral load in the system. Isn't that amazing? So I just want to encourage you, in as much as we keep on doing our routine checks in other related health conditions, we should also make sure that we add HIV tests to our routine tests. I will recommend that everyone should at least check your HIV/AIDS status every 3 months. Because mind you, the fact that HIV doesn't have a vaccine means that if you are free from contracting it today, but you can still be exposed to the infection as many times as possible. So let's develop the habit of constantly checking our HIV/AIDS status. And you can do this by, walking into any medical facility or health facility and ask for your HIV test to be done. I want to encourage mothers who are HIV/AIDS positive. It is possible to deliver a baby who will be HIV negative if you take your antiretroviral therapy seriously and take it according to how it was prescribed. You will deliver a bouncing baby that will be tested negative for HIV. So in this video, I want to encourage whoever that has been watching that HIV is real and there are interventions that can prevent you from developing the deadly AIDS, which is the disease form of the HIV infection. So get tested today. Get your family tested. Make sure everybody around you is safe and prevent these predisposing factors that can expose you and your family to getting HIV. I remain your public health nurse, Ruth. See you another time. Bye.